Despite lots of ads, international campaigns, decades of medical research, and a lot of public disdain, the Centers for Disease Control says there are still women who smoke during pregnancy. CDC finding that 1 in 14 pregnant women lighting up with traditional cigarettes, e-cigarettes, and marijuana.
The good news is that doctors say if a woman quits smoking even days before she delivers, it actually can make a difference. Joining us with more information, Alice Benjamin. She's an emergency room registered nurse and nurse clinical specialist. Good morning.
Good morning.
You know, when we were talking about this yesterday, it surprised us to know that this is still happening. Women are still smoking while pregnant. The results of a CDC report, it covered a wide range of pregnant smokers. So what is the breakdown of who are they? How old are they?
Right. So the common theme with the information provided by CDC is that the younger a woman is and the less educated she was, the more likely she was to smoke. So the group most likely to smoke were between the ages of 20 and 25, followed by 15 through 19-year-olds. These were also women who they looked across the nation and where do these people live. Concentration was found in the Midwest and back east. And in fact, in West Virginia, 25% of women pregnant were found to smoke. Here in California on the West Coast, less likely to smoke, less than 2%. And so it's very interesting when we look at the demographics, especially different ethnic groups. Native Americans, most likely to smoke, 17%, followed by whites at 11%, and African Americans at 6%.
Could the numbers, frankly, be even higher, though, if not for the stigma?
And I'm afraid so. And the reason being is because when people go to their doctors, they're afraid to displease their doctors. And there's lots of public shaming about smoking that's out there. So people underreport. So they'll say they don't smoke, or they'll misrepresent what they do smoke. And so it's very misleading that this information. So the CDC has this report, and it's generalized information, but we do know that people are less likely to report that they actually do these things.
Wow.
Yeah. So what would the cause be if a woman is pregnant and she's smoking to the unborn baby?
So it's very dangerous. So what happens is we know that the carbon monoxide in tobacco smoke displaces oxygen, and baby needs oxygen to properly develop. So without that oxygen, you're going to have other problems. You might have premature birth, you might have certain birth defects, you'll be at risk for learning and cognitive and physical disabilities, higher risk for infant death syndrome. So there's lots of bad things that can happen when mom does smoke.
What is there, or is there a connection between tobacco and miscarriage?
Absolutely. So whenever a woman smokes, it's more difficult for her to get pregnant, and once they are pregnant, they're at a higher risk for having a miscarriage. They can very well have problems with their placenta, which is very important. It can detach from the womb and cause bleeding, which then would cause mom to miscarry.
There's also some research that links maternal smoking to a facial defect. What did they learn here?
Yes. So already 1 out of 33 children are born with a birth defect. When you smoke, it puts you at a higher risk of birth defects, and more commonly a cleft palate or a cleft lip. So very simple, as when we're born, you know, we're kind of flat, we're a cell. And then, you know, tissue circles around and then we're formed. There's a misalignment with the tissue when it comes to our lip and our palate, so it doesn't align well, and there's that little gap and space. So it's those facial defects, although they can be corrected, still can lead to long-term problems with eating, speech, and hearing problems.
It tells you something, though, if a picture like that doesn't, instill the guilt to prevent you from smoking. A craving is incredibly strong. A habit's incredibly strong. What do you believe the solution is? So
the solution, it starts today with this broadcast. So I think it's about education and talking to people and maybe taking away some of that stigma, because I think that stigma can have a negative impact on one's ability to learn. So yes, OBGYN doctors have this conversation, but more pediatricians, more general practitioners need to have a preconceptual conversation. And us at the dinner table and community, holding people accountable and also looking at why they're smoking. Maybe this is an unhealthy solution to depression, or they're misinformed. So really looking at what the why is and having table conversations about this. As soon as a kid is able to learn that cigarettes are bad and they cause heart attacks and strokes, they also should be learning at that time that, hey, this can also cause problems if I ever decide to be a mom. So.
Alice Benjamin, emergency room RN and clinical nurse specialist. You can follow her on social media and check out her website, asknursealice.com. Thanks for being here.
Thanks for being here this morning. Appreciate it.